Welcome back to Metabolic Mind, where we're working to revolutionize the treatment of mental illness by providing information and resources at the intersection of metabolic health and mental health. I'm Dr. Bret Scher. Metabolic Mind is a nonprofit started by Roblox founder David Baszucki and his wife Jan after their son Matt sent his psychiatric symptoms into remission with a metabolic intervention, nutritional ketosis. Our goal is to help families like theirs learn about this new approach to treating mental disorders and to offer a message of hope. Freedom from the burden of mental illness is possible. Today, I'm excited to introduce you to the 2022 Metabolic Mind Award recipients. The Baszucki Group, launched by Jan Ellison Baszucki along with her husband David Baszucki, partnered with the Milken Institute Center for Strategic Philanthropy to launch the Metabolic Mind Awards program to honor clinicians working to advance the emerging field of metabolic psychiatry. This year's award was for the use of ketogenic metabolic therapy in mental illness. After a competitive application process, 7 people each received awards. What's exciting is that the awardees reflect an international group of clinicians, advocates, and educators furthering the field of metabolic psychiatry. The 2022 Metabolic Mind Award winners are psychiatrists Dr. Chris Palmer, Dr. Georgia Ede, Dr. Ignacio Cuaranta, and Dr. Albert Danan, as well as dietitians Denise Potter and Beth Zupac-Kanya, and mental health counselor Nicole Laurent. In this video, you'll hear from Drs. Palmer, Ede, Cuaranta, and Danan about their work, what it means to them to receive this award, and what it means for the future of metabolic psychiatry. And in our next video, we'll highlight the same for Ms. Zupac-Kanya, Potter, and Laurent. But first, I want to remind everyone that our channel is for informational purposes only. We're not providing individual or group or medical healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision, so consult your healthcare provider before changing your lifestyle or medications. Now let's get to the award recipients. Let's meet Dr. Chris Palmer. Dr. Palmer has been very vocal about a novel hypothesis of the cause of mental illness with the release of his new book, Brain Energy, a revolutionary breakthrough in understanding mental health and improving treatment for anxiety, depression, OCD, PTSD, and more. Now, Dr. Palmer has 20 years of experience treating patients with metabolic interventions like the ketogenic diet. He has used his global lectures, website, media appearances, and social media presence to raise awareness of metabolic psychiatry among clinicians and the public. Chris has seen firsthand the impact of ketogenic diets for his patients, and he wants to spread that message to impact thousands more. Here's Dr. Palmer.
Yeah, I think it's been about 20 years now that I have been using low carbohydrate or ketogenic diets in clinical practice. And I started using them in patients with treatment-resistant depression, personality disorders, anxiety disorders, and certainly people who had comorbid obesity and type 2 diabetes. I was using it commonly in those patients. However, I was not publishing. At that point, the ketogenic diet and low-carb diets were highly controversial. I saw clinicians and researchers losing their licenses or at least being threatened. And I didn't want to be part of that. I wasn't, it didn't feel like what I was doing was bold and dramatic enough to risk losing my license over. And that all changed in 2016 when I helped, a patient with schizoaffective disorder lose weight initially. And by better understanding those mechanisms, I was able to publish case studies, publish research articles, outlining some of the scientific rationale for why this should be taken seriously. At the end of the day, I didn't stop there. I could have stopped with the ketogenic diet seems to be an effective intervention for serious mental illness. But I think what shocked me was that I was able to put some people's serious chronic mental disorders into full remission. And that went against everything that I knew and had been taught as an academic psychiatrist. Chronic mental disorders aren't supposed to go into remission, certainly not off medication, and certainly not from a diet. And so that led me on a very deep dive into trying to understand the science of what was happening, but more importantly, trying to understand what can this tell us fundamentally about the actual root cause of mental illness And could these insights somehow be helpful to the field? And so through all of that, I have published research, I have spoken globally on this topic, and I have a book called Brain Energy, in which I have detailed the science of the metabolic theory of mental illness, which helps, I started writing that book trying to understand how and why would the ketogenic diet help mental disorders, with the full knowledge and appreciation that it also helps epilepsy, but it also helps people who are overweight or obese, and it also helps people with type 2 diabetes. And I'm trying to understand how are those all connected? And at the end of the day, by connecting all of those dots, using the science that is already published, I think it leads to what I hope will be a transformation in the mental health field.
That's such a great story about his experiences as a clinician, driving the curiosity of why therapeutic ketosis would work for mental illness. And that led him on a path to propose a new model involving mitochondrial function as the core contributor. We'll hear more from Chris later in this video, but now let's meet Dr. Georgia Ede. Dr. Georgia Ede is one of the earliest pioneers of metabolic psychiatry. In addition to using ketogenic therapies in clinical care, she has been educating the public about nutrition science, metabolism, and mental health for over a decade through her international speaking engagements, comprehensive website, and social media presence. She's also the creator of the first CME-accredited mental health clinician training program focused on the ketogenic diet. So here's Georgia.
Thank you very much. It's such an honor to have been named as a recipient of this new award, and it means so much to me that the work that I've been doing for the past 10 years is valued by the metabolic psychiatry community. And what I love doing most is educating, empowering, inspiring people about that really powerful connection between nutrition and brain metabolism and mental health. And these are also central, as it just so happens, to the mission of the Baszucki Metabolic Mind Award. So it's really it's hard to put into words how much it means to me. And I'm really proud to be among the other 6 recipients as well, some of whom are really good friends, and I'm happy for them as well. Yeah, so I launched the website about 10 years ago. So that was the beginning of my exploration of these topics. But some of the more recent projects I've initiated have been, I think, more connected to what the award is what the award stands for. So, for example, some of the projects I've initiated that serve that mission, they include the development of the first and only, so far, CME accredited ketogenic diets for mental health clinician training program. There are still far too few practitioners with the knowledge and skills needed to safely incorporate metabolic therapy into clinical practice. So this is my way of helping increase access by putting these powerful metabolic therapies safely in the hands of clinicians of all disciplines. And as of this January, we will have trained nearly 200 clinicians from 24 countries. And I'm really, really excited about that. And the other piece of that puzzle that I'm excited to share is that we're about to launch later this month, December, a searchable international clinician directory as a free public service to help patients find mental health clinicians and help clinicians find each other. And so any clinician who provides clinical services in this area that supports patients with mental health concerns using ketogenic therapies will be encouraged to submit their practice listing for publication. Will not cost a thing. And they can be listed in the new database. And that will again, also be the first one of its kind. And so, I'd like to call this growing clinician community the early adopters of the science of hope. I think we're really working hard together to improve, to help people improve their own lives, to really empower them with these tools. And so those were a couple of the projects. And then I also, in the past year, wrote and published a paper in collaboration with Dr. Eric Westman, Dr. Laura Saslow, documenting the pioneering clinical work of my friend, colleague, and fellow Metabolic Mind Award recipient, Dr. Albert Danan, a psychiatrist in Toulouse, France, who placed 31 of his most seriously chronically mentally ill patients on a medically supervised ketogenic diet in a hospital setting. And that paper, which is entitled The Ketogenic Diet for Refractory Mental Illness, was published in June of 2022 in Frontiers in Psychiatry, which is an open access journal. So anybody interested can read about his remarkable, very promising observations. So we're really pleased that we were able to bring that to publication. And then, as you were saying, I do a lot of writing, and dozens of free articles for people who want information about these topics on my website, on Psychology Today, on Diet Doctor, and then I'm writing a book. This year, it's entitled "Change Your Diet, Change Your Mind," and really, what that is about is I want people to know that they have so much more control over their mental health than they realize. And in this book, I argue that we need to rethink the science of brain food from the ground up. And it really explains, how to nourish, protect, energize the brain by improving the nutritional and metabolic quality of the diet. And it explains, which dietary changes are most worth making and why, because most people think they've tried everything and it hasn't worked. And it provides 3 new dietary strategies for people to try, one of which is a uniquely modified ketogenic diet. And these will all be spelled out with meal plans and recipes by fabulous nutritional therapist, Patricia Daly. So I'm trying, really to help people help themselves, because no matter how many clinicians there are in the world, I think, it'll be a long time before we have enough to go around. So hopefully that will make a difference as well.
Dr. Eid has been involved in such impactful work, from her clinical practice to publishing the paper she mentioned with Dr. Albert Danan, who we'll hear from next. And what really makes Georgia stand out is her CME training course, which I took and thoroughly enjoyed. Anyone interested in treating individuals with mental illness with therapeutic ketosis may want to consider looking into her course. I think it's well worth the time personally. But as Dr. Eid mentioned, our next award recipient is Dr. Albert Danan, a psychiatrist at the University of Toulouse in France. Dr. Danan has practiced psychiatry for 35 years and recently published data about patients in his clinic whom he treated with ketogenic nutritional therapy. This body of work represents the largest inpatient study of the intervention for psychiatric patients and paves the way for future pilot and randomized controlled trials. Here's Dr. Danan sharing his story of what got him interested in nutritional ketosis and how it changed his practice and eventually led to his clinical study.
Yeah, thank you. I'm very glad to join you. What I can say is that this work started when a young member of my family was having seizures and was also autist. He was seizing very harshly, despite all the medications he got, all the combinations of anti-epileptic drugs. His father was turned interested in ketogenic diet, and he put his son on this treatment, on this measure. And I observed on a very short time a very huge improvement. And this adolescent was very soon got free from all the seizures. And above all, could notice also a very serious improvement of his autistic behaviors. So that gave me the will to go deeper. I tried to apply the method to myself because to try to get some benefits on some inflammatory problems, you see. And then I went deeper in the topic. I started treating my outpatients in my office. Okay, I thought that there are many common points between neurology and psychiatry, between epilepsy and mental disorders. First of them is the common point is the brain, and also the medication we use. So I started like that. I noticed very good results. That encouraged me also to think to apply the method to much more serious patients those who relapse, those who have poor results with conventional treatments, or very important side effects. So I decided to treat them. They were, I include 31 patients in the clinic where I was working. All those patients, I must say, were patients that that I knew for a long time, for many years, and that I treated on many occasions on the same conditions. It means in hospitalization. The only difference at that time was the ketogenic diet. And I observed 31 patients. They were serious schizophrenic patients, bipolar patients, depression. I observed very significant improvements on their clinical conditions, reducing delusions, reducing hallucinations, getting much better mood balance. This is on the clinical on the clinical level. I observed that all the patients lost weight, which is a great challenge, an impossible challenge usually on those conditions with over-medicated patients on the clinic where they can eat what they want, and especially with a lot of treatments. I observe also a very good evolution on their metabolic status, and for 65 of them, we could reduce the treatments they were having.
So did you catch those results? 100% of the patients saw symptomatic improvement, and 65% were able to reduce their medications. That's pretty impressive. And it's interesting, though, to put this study in perspective. For example, it was only 31 patients, and it wasn't a randomized trial. Does that matter? How do we interpret results from such a trial, and what can we expect the impact to be, especially when the researcher is at the forefront of an emerging field? I think these are interesting questions, so let's hear what Dr. Danan has to say.
You're right. This is not. This is a small amount of patients. 31. It's not randomized, but I just did it because I wanted to check the benefits, and on the ground, it works. What I can expect is that I think that metabolic psychiatry is a very interesting way for the future to treat our patients, because when you see with conventional treatments, the results are good but limited. During my 35 years of exercising psychiatry, I saw many relapses, many side effects. So we can't go on treating blindly our patients without considering the side effects. I mean the gain of weight, the obesity. They can be affected. They can be suffering. This is a matter of public health, I think, because you have not only that, you have metabolic syndromes, you have all the complications, metabolic complications, diabetes, cardiovascular disease, cancer, strokes, and so on. So our patients see their life expectancy tremendously reduced, 10 years, 15 years. We can't go on like this, being focused on the symptoms without considering those aspects. It's impossible. It's what I experience is that it's a safe method, easy to apply, feasible so why shouldn't we consider this option for the future? That's why. And as you said, we can expect more studies, randomized studies with largest cohorts, and I think that's on the way. So, or I hope.
Dr. Danan made such an important point. We can't continue solely focusing on symptoms when our patients are dying 20 or more years prematurely. Why shouldn't we consider a safe and potentially effective approach? Dr. Danan believes his study will help clinicians reflect on this question and hopefully begin to realize the potential of therapeutic ketosis. Now, our fourth Metabolic Mind Award recipient is Argentinian psychiatrist Dr. Ignacio Cuaranta. Dr. Cuaranta has been using metabolic approaches to treat patients since 2015. He's contributed significantly to metabolic psychiatry by engaging with the public through lectures and social media, as well as promoting ketogenic metabolic therapy for mental health at conferences worldwide. He also is a vocal advocate of the importance of maintaining and optimizing circadian rhythms to improve mental health.
Well, thanks a lot, Bret. I am really honored for receiving this Metabolic Mind Award, especially because it gives me this much needed support in regards to, beside the recognition for the work that I try to do every day in my clinical practice, in addition to trying to popularize and democratize or the nutritional interventions and trying to make them a first order intervention, as I like to say in my initial slides when I have the opportunity to give a talk. So this is what I think sums up my interventions, is that trying to make people understand that metabolic interventions are first order intervention and it's not alternative medicine. So my practice in general terms delves around trying to help patients find their metabolic health as a basis for brain health and other trying to address other health conditions as well.
Dr. Cuaranta uses nutrition as a first-order intervention, and that's a point I want to explore more. And you'll hear similar approaches during my conversations with dietitians Beth Zubeck-Kanya and Denise Potter in our next video. Nutrition shouldn't have to wait for failure to respond to medications. So first, let's hear from Dr. Cuaranta about the differences and similarities he sees in Argentina compared to what we see here in the U.S. and other countries.
I can see some differences, a lot of differences, of course, cultural differences in each country where my patients belong, but there are also many similarities, and sometimes I try to focus on this similarity that are the ones that are probably propelling the health of the population to going downward in regard to their metabolic health. Most of the challenges that I see is that most people inhabiting in current Western societies are inhabiting in highly obesogenic environments. And this is one of the most important challenges that I see in my everyday practice, because we might have a very good intervention, we might have an ideal intervention of what we see as a great therapeutic intervention, but our patients have to inhabit highly pathologic environments in many senses, where most of the food stuff they have to navigate their lives around are inducing pathologic states in our patients. And in addition to that, there's also another challenge for each one of our patients, that is how they handle stress, how are they handling sleep issues, and how our environments are highly stimulant in a sense in regards to technology use and how it's affecting sleeping patterns. And we all know how this affects metabolic health. And having in mind this eating and fasting schedules and intervening with in regards to their food or eating habits and how they manage stress, this has unique opportunities in each culture. But I try to focus in that circadian structure as a whole, and I see that that's one of the main challenges. People having highly disrupted circadian rhythms, and eating behaviors, being able to intervene there like as a high therapeutic option. It's allowing me to help them to regain some control back in regards to their health in their own hands, let's say.
As you can hear from Dr. Cuaranta, mental health treatment goes beyond what you just eat, right? Sleep, stress, constant tech stimulation, and of course, our obesogenic environment all play a role. And for Dr. Cuaranta, focusing on circadian structure provides a framework for treatment. Now let's go back to Dr. Palmer and Dr. Eid and hear what awards like the Metabolic Mind Award mean for the future of metabolic psychiatry and how they've already seen the field changing.
It's just amazing how much has happened in that 10 years. So when I first started exploring these topics and thinking about them and writing about them, I didn't know of anybody else in the field who was exploring these topics. And now, thanks in large part to the Baszucki Group, there is a metabolic psychiatry community where so many of us who may not have been aware of each other's work or may have only read about each other's work and not met each other, we have now gathered. We are in communication with each other. We support each other. We collaborate with each other. We learn from each other. And, this is really all due in no small part to the vision and the hard work and leadership of Jan Ellison Baszucki, who, in a period of 6 months, created a community out of thin air. And it's just been so exciting to be part of something bigger. You had also asked, how else have things have changed? So there's much more public awareness of ketogenic diets and mental health. There's much more interest in ketogenic diets for mental health. I receive so many requests per week for people looking for these services. There's no way that I could see all of these patients, and I think that's good news and bad news. I mean, the bad news is there are people looking for help who can't find it, but the good news is that people are looking for these services, and so many clinicians come to take the training program because one of their patients said, "I'd like to try this. Can you help me?" And so many of us clinicians, we learn more from our patients than we do from most other sources. So, I really think that awards like this, the way that they help us, the creation of the award itself shines a light on the field and helps to call the public's attention to the importance of metabolic psychiatry. And the generous financial support that comes with the award helps a great deal because so many of us who are working independently in this field, we do so not for profit, but for passion. And most of the initiatives that I've undertaken have been, at my own expense. And so it really helps. It helps to defray the costs of those initiatives. And it helps us to spend less time thinking about the financial sustainability of a given project and more time thinking about which projects will do the most good in the field. And so, and it will also help me continue to offer some training spots to students and clinicians who otherwise wouldn't be able to afford it, which I always try to do, and to continue to see some patients pro bono or at a reduced fee, which I also would like to continue to do. So the impact is just tremendous on both on a macro and micro scale.
So first of all, it is a ridiculously great honor to be getting this award. When I started doing this work, I was never getting paid for it. It was all just on my own time, a kind of a hobby. I assumed a hobby that others wouldn't necessarily respect all that much or appreciate all that much. So the fact that it has flourished and I am now being recognized along with other pioneers who've been doing this work is simply nothing short of amazing. I think first and foremost, this award and even the prize that comes with it will allow me to continue this work and hopefully escalate the work that I'm doing, potentially with the goal of scaling some of the impact of this, whether it's through research, education, clinical care, and advocacy. I am hopeful that it will also inspire and motivate other researchers, clinicians, but probably most importantly, patients and families and friends who are suffering from mental illness to recognize that there is a new way, there is a new path to treating serious mental illness or just everyday chronic mild mental illness. It's across the board.
We're so grateful for these pioneers and all their work to help educate us about metabolic therapies for mental illness. We look forward to continuing to highlight their work as they continue transforming psychiatry through metabolic treatment. In our next video, we'll showcase our other 3 2022 Metabolic Mind Award recipients, dietitians Beth Zupek-Kanya and Denise Potter, and mental health counselor Nicole Laurent. So please check out that video to learn more about them. And as always, if you found this helpful, please click the thumbs up and subscribe buttons and make sure to share this video with your family, your friends, your healthcare providers, so you can help spread our message to as many people as possible. And also please leave a comment. We'd love to interact with you and hear what you found most helpful. Thank you so much for watching. Have a great day. Take care of yourself, take care of others, and we'll see you here next time at Metabolic Mind.